The domestic policy of President Donald Trump. Healthcare. The 2010 Patient Protection and Affordable Care Act, also known as Obamacare or the ACA, elicited major opposition from the Republican Party from its inception, and Trump called for a repeal of the law during the 2016 election campaign. On taking office, Trump promised to pass a healthcare bill that would cover everyone and result in better and less expensive insurance.
You're going to have such great healthcare at a tiny fraction of the cost, and it's going to be so easy.
Throughout his presidency, Trump repeatedly asserted that his administration and Republicans in Congress supported protections for individuals with pre-existing conditions. However, fact-checkers noted the administration had supported attempts both in Congress and in the courts to roll back the ACA and its protections for pre-existing conditions. Congressional Republicans made two serious efforts to repeal the ACA. First, in March 2017, Trump endorsed the American Health Care Act, or AHCA, a Republican bill to repeal and replace the ACA. Opposition from several House Republicans, both moderate and conservative, led to the defeat of this version of the bill. At the time, Trump said the best thing politically is to let Obamacare explode. Second, in May 2017, the House narrowly voted in favor of a new version of the AHCA to repeal the ACA, sending the bill to the Senate for deliberation. Over the next weeks, the Senate made several attempts to create a repeal bill. However, all the proposals were ultimately rejected in a series of Senate votes in late July. Trump reacted by alternately urging Congress to keep trying and threatening to let Obamacare implode. The individual mandate was ultimately repealed in December 2017 by the Tax Cuts and Jobs Act. The Congressional Budget Office estimated in May 2018 that the repeal of the individual mandate would increase the number of uninsured by 8 million, and that the individual healthcare insurance premiums increased by 10% between 2017 and 2018. Trump repeatedly expressed a desire to
let Obamacare fail,
and the Trump administration has undermined Obamacare through various actions. The open enrollment period was cut from 12 weeks to 6. The advertising budget for enrollment was cut by 90%, and organizations helping people shop for coverage got 39% less money. The CBO, that's the Congressional Budget Office, found that ACA enrollment at healthcare exchanges would be lower than its previous forecasts due to the Trump administration's undermining of the ACA. A 2019 study found that enrollment into the ACA during the Trump administration's first year was nearly 30% lower than during 2016. The CBO found that insurance premiums would rise sharply in 2018 due to the Trump administration's refusal to commit to continuing paying ACA subsidies, which added uncertainty to the insurance market and led insurers to raise premiums for fear that they would not get subsidized. The administration sided with a lawsuit to overturn the ACA, including protections for individuals with pre-existing conditions. The administration ended subsidy payments to health insurance companies in a move expected to raise premiums in 2018 for middle-class families by an average of about 20% nationwide, and cost the federal government nearly $200 billion more than it saved over a 10-year period. People with lower incomes would be unaffected because the ACA provides tax credits that ensure their out-of-pocket insurance costs remain stable. The administration made it easier for businesses to use health insurance plans not covered by several of the ACA's protections, including for pre-existing conditions, and allowed organizations not to cover birth control. Survey results indicated that more than 10% of companies with more than 200 employees would opt out of birth control coverage if they had the option. In justifying the action, the administration said contraceptive use caused harms, such as risky sex behavior. They cited the potential side effects of contraceptives and asserted that the relationship between contraceptive use and unintended pregnancy was uncertain and complex. I guess they're the FDA now. Indiana University professor of pediatrics Aaron E. Carroll noted, "There is ample evidence that contraception works, that reducing its expense leads to more women who use it appropriately, and that using it doesn't lead to riskier sexual behavior." The administration proposed substantial spending cuts to Medicare, Medicaid, and Social Security disability insurance. Trump had previously vowed to protect Medicare and Medicaid. As a candidate and throughout his presidency, Trump said he would cut the costs of pharmaceuticals. During the first 7 months in office, there were 96 price hikes for every drug price cut. Abandoning a promise he made as a candidate, President Trump announced he would not allow Medicaid to use its bargaining power to negotiate lower drug prices. The administration reduced enforcement of penalties against nursing homes that harm residents. The opioid epidemic. Trump nominated Tom Marino to become the nation's drug czar, but the nomination was withdrawn after an investigation found he had been the chief architect of a bill that crippled the enforcement powers of the DEA and worsened the opioid crisis in the United States. Kellyanne Conway led the White House efforts to combat the opioid epidemic. Conway had no experience or expertise in matters of public health, substance abuse, or law enforcement. Conway sidelined drug experts and opted instead for the use of political staff. Politico wrote in 2018 that the administration's main response to the opioid crisis so far has been to call for a border wall and to promise a Just Say No campaign. In October of 2017, the administration declared a 90-day public health emergency over the opioid epidemic and pledged to urgently mobilize the federal government in response to the crisis. On January 11, 2018, 12 days before the declaration ran out, Politico noted that, beyond drawing more attention to the crisis, virtually nothing of consequence has been done. The administration had not proposed any new resources or spending, had not started the promised advertising campaign to spread awareness about addiction, and had yet to fill key public health and drug positions in the administration. One of the top officials at the Office of National Drug Control Policy, which is tasked with multi-billion-dollar anti-drug initiatives and curbing the opioid epidemic, was a 24-year-old campaign staffer from the Trump 2016 campaign who lied on his CV and whose stepfather went to jail for manufacturing illegal drugs. After the administration was contacted about the official's qualifications and CV, the administration gave him a job with different tasks.
We have to go to a plan that works. We have to go to a much less expensive plan in terms of premiums. And something will happen, and it'll be very good. May not be as quick as we had hoped, but it's going to happen.